is Dr. Bertha, and this is the last in the video series I'm doing on breast cancer. Next, we're going to be talking about treatment options. So now you've been diagnosed with breast cancer, so what? Or you have a family member who's been diagnosed. What are the options? Obviously, the first thing is let's get this cancer out of your body, if it's possible to get it out. At stage 4 or advanced breast cancer, where it's metastasized or moved all over the body, there's really no surgery that may be needed. But for the early stages, stage 0, stage 1, stage 2, the part of the breast that's affected can be removed. In fact, they can remove the whole breast. It's called mastectomy. Or you can undergo what is called a lumpectomy, where the lump is removed. The abnormal area is removed, and then they also remove some. So mastectomy, the whole breast comes out. Lumpectomy, just a part of the breast. And it's been proven that at some stages, like stage 0, for example, a woman can choose to have a lumpectomy and radiation and just those two alone, or choose to have a mastectomy, and sometimes the outcome is the same. My personal bias is that if you can do a mastectomy, do that, because for some women 20 years later, these cancer cells were hiding in some part of the body, and then they rear their ugly head. The next thing I'm going to talk to you about in terms of treatment are receptors. Things on the cancer cell that can be used to treat the cancer. So you all probably know about estrogen and progesterone, the things that make us female. If you have a normal menstrual cycle every month, your body gets a certain level of estrogen and amount of progesterone released by your ovaries and also by your brain that keep you menstruating and able to have children. Unfortunately, this same estrogen and progesterone can have receptors on the breast cancer cell that seems to rank it up and tell it to keep multiplying and misbehaving in the body. So there are estrogen receptors sitting on these cancer cells, and there are progesterone receptors sitting on these cancer cells. The other receptor that has been found out lately is the HER2 receptor, HER2 receptors. So when you have cancer and the surgery is done, they can give you what they call hormonal therapy, which essentially blocks estrogen and progesterone and sort of shuts the whole production of cancer cells down. You can also have HER2 inhibitors that also shuts the cancer production down. Unfortunately, Black women have sometimes what they call triple negative breast cancer, meaning their breast cancer doesn't have these receptors. Now, when you have these receptors, the good thing is essentially they can be blocked. But if you have triple negative breast cancer, in other words, this cancer is running amok and there's really nothing you can do to block it. In some case series, especially involving Ghanaian women, the triple negative breast cancer, which is more aggressive, has been found in up to 85% of women. And that is why women who have breast cancer. And that is why you should make every effort to get a mammogram, so we're not having to chase after these receptors. So what are the kinds of surgeries that you should expect if you've been diagnosed with breast cancer? You can have a biopsy where the radiologist just goes in and examines the breasts and is able to perform a biopsy of the breast to even make a diagnosis. And then there's lumpectomy and mastectomy, and their options include radiation, chemotherapy, hormonal therapy, targeted therapy, and immunotherapy. So here's the interesting thing about chemotherapy. For some women who have estrogen and progesterone or HER2 receptor positive breast cancer, there are tests that are available, an analysis from the breast tissue that would give both a risk of recurrence and also give a clue as to whether you should even undergo chemotherapy. In the past, it was a guess. Now it's not a guess. There's a test that can actually tell whether your breast cancer would even be susceptible to chemotherapy. because chemotherapy would attack any cells that are multiplying, which include your hair cells, your mouth, your stomach, anything where there's rapid multiplication, it will be attacked. And that's why patients finish chemotherapy and they've lost all their hair, the mouths have ulcers, and sometimes they're experiencing diarrhea. So, in a nutshell, that is what treatment for breast cancer involves. But please remember stage 0 and don't let your breast get to stage 1 to stage 4 breast cancer, because the horse is out of the barn. Thank you for watching. In my last video, we will talk about support for breast cancer.